We're gonna do Trach Care. The first thing I'm gonna do is I'm gonna get my saline. That's a sterile field. I'm gonna put it out of my way. I'm gonna palm my bottle. I'm gonna lift it. I'm gonna get my tray open with a sterile tray. I got it above my waist. I'm gonna open it away from me. And I'm gonna move this tray immediately. I'm gonna put it in a position where it's kind of out of my way so I can have room to put my drape when I get my drape out of the box. And I see the shiny part on the glove, just like on our sterile gloves. I'm gonna pinch the first one. I'm gonna step back, try to go palm up. We'll see how it's packaged. I'm gonna scoop the second glove. And I'm ready to get my drape. I'm gonna step back, open this drape up. I want to be careful laying it down. There is a shiny side that's waterproof and a dull side. It doesn't matter. We're gonna try not to wet it, because when you wet a sterile field, it contaminates it. So we're not gonna wet it anyway. Right now, I can touch everything inside of the box. So I want to get my supplies out, and I want to separate it kind of in the order that I'm going to use it. So now I have to make a decision. I'm right-handed, I'm on the right-hand side of the bed. I would like for my right hand to be my sterile hand to run my sterile field. So at this point, I'm gonna contaminate my left hand and do the dirty task with my left hand. So I'm going to come around, I'm not gonna reach over my sterile field, and I'm gonna pour my saline. Pull this drain sponge, and I'm going to remove the inner cannula. I'm going to drop it in the first compartment to soak. I'm going to use my right hand on my sterile field, my sterile hand. Once you remove an item off of the sterile field, you can't lay it back down or put it back because it's contaminated. I'm going to get my cannula, I'm going to step back, and I'm going to clean it. Then we're going to rinse it. I'm going to start drying it. Every time I use an item off the sterile field, I'm going to throw it off and not put it back. Cleaned it, I rinsed it, I dried it, and now I can put the cannula back up. And at this point, I'm going to kind of hitchhike this hand out of the way, because I'm only going to be using my sterile hand to run this field. So now we want to do the stoma care. Each time I used a different compartment. I used one to scrub, one to rinse, and I have one left to do my stoma. And I'm going to clean the bottom. Doesn't matter if you do the top or the bottom first, or do the top. If I needed to dry, I could dry. Now I'm ready to put my drain sponge back under. And at this point, you're pretty much done, where you can use your left hand to manipulate the trach collar to get the drain sponge back up under. And then you would cut and change your ties.